Bispecific antibodies has been a very welcome advance for the treatment of patients with a relapsed large cell lymphoma. Fortunately, we do cure a substantial percentage of patients with large cell lymphoma with frontline therapy, but there is a significant percentage of patients who do present with relapse disease. In the past, our options were limited to chemotherapy and possibly some immune therapies and CAR T cell therapy. Sometimes it's hard to get patients controlled adequately to transition to CAR T. There is a process for harvesting the cells for CAR T manufacturing. It does take time, and the turnaround time can vary. During that time, patients can also have fairly aggressive disease progression. So there is a subset of patients who may not have the luxury of time to allow us to deliver CAR T cell therapy. Uh, in addition, there are patients who may not have a good response to CAR T cells. They may have progressive disease right after CAR T cell therapy. So those are the patients in which there are limited options available. So having access to bispecific therapies has been great so that a subset of our patients can get these therapies right away without having to wait to undergo any manufacturing. These are off-the-shelf immune therapy approaches. And initially, it was used in the third-line setting and for patients who may not be candidates for CAR T cell therapy, and now slowly in different ways and clinical trials and indications are getting more and more available and accessible to a larger number of our patients. So it's been a great advance generally for large cell lymphoma patients.